Hello, everybody. I'm back with a video clip. This clip is basically for my Facebook cognitive behavior therapy group, but I'm going to post it on my YouTube channel as well, so other interested viewers can watch it. The Facebook cognitive behavior therapy group is progressing fairly well. We have now over 700 members in it. For the last several weeks, we have been organizing ourselves and we started discussing the difference between information and knowledge. Uh, this video clip essentially is to summarize what we have discussed in the Facebook group up till about 2 weeks ago. But the discussion on information versus knowledge is ongoing. So there will be a few more video clips on this subject matter, and we will continue to discuss different case scenarios, examples in the Facebook group. Now, this video clip also gives a brief introduction about how we have organized the group or how I am thinking of organizing it in the near future. Now, all clinical professionals, and in this group 90% plus are clinical professionals, so they know that clinical professions constitute a clinical side, a teaching side, a research side, and a leadership side. And these are not mutually exclusive. Usually they are people are interested in clinical work, but some clinicians like to teach as well, some clinicians like to engage in research as well, and a few clinicians want to take on leadership roles as well. So in terms of how I'm going to slowly evolve the group, I know most of you are interested in clinical aspects of psychology and CBT, and I promise that we will get to that point, but it will happen probably a few months down the road. Right now, I want to focus on certain academic aspects, especially pertaining to teaching, because I want to lay down strong foundation. I want to really emphasize and reiterate certain academic points that, in my view, differentiate an academician from a developed country versus an academician from a developing country. Now, I have been in leadership roles, I have been in clinical roles, in research, and various committees, and both in Pakistan for several years, and then in US and Canada for almost 25 years. So I have seen both sides pretty closely, and I want the focus of the Facebook group is to slowly evolve a team of academicians who have those skills and orientation and mindset that the academicians of developed countries have, so that they can move things forward in those developing countries. We will also talk about research and leadership matters down the road if needed, if there is sufficient interest among the group members. I want to highlight that I have about 1 year to organize and get this group going. So by next summer, I have lined up other personal academic activities that I will need to focus on. So please help me develop this Facebook group over the next year, and we will so that we can enhance the academic activities in the developing countries. Now, I have had numerous interactions with academicians in Canada and US, and over the years, even after leaving Pakistan, I've had numerous interactions with academicians in Pakistan, and I have found it difficult to explain certain academic aspects to those academicians. And personally, I think the reason is that the academicians who are who ultimately work and get further trained in the developed countries, they realize that the academic environment of the developed countries is very different from the developing countries, starting right from the elementary school level. So here in countries like Canada, uh, right from the elementary school level and slowly progressing through middle school and high school levels, the students are encouraged to read, summarize, to write essays, to conceptualize things, to do literature search, to make presentations, to think critically and analytically, to do research projects, to be inquisitive, to engage in discussions, to work as teams. So all these things, the students are exposed to them even at the elementary and middle school levels. And so by the time they go to college or university or a professional institute, they have already, the way their mind works is different than a student or some student from a developing country who has not been exposed to these sort of academic stimuli during the middle school or primary school years. Now, what I'm trying to do in the Facebook group is there are a few very fundamental things that I figured out that differentiate the thought process of an academician in a developed country versus in a developing country. And I'm trying to highlight those aspects for the initial several weeks, so that when we start talking about more clinical and academic aspects, at least some members in the group can understand what I'm talking about. Now, for the group members, I hope that they can organize and do these 5 things. Firstly, to stay focused. Now, if I post a 5-minute post, if I make a post that's about a 5-minute read, I hope you can read it in a focused manner, not by browsing, reading a few lines and then going back and seeing what new notification has come and then coming back and reading it again, or simply reading it when you're doing something else as well. Because this is not, even though it's happening on Facebook, this is not a regular Facebook stuff. This is an educational Facebook group. So I hope you can do things and read whatever I post in a focused manner, or whatever articles I share in a focused manner. Secondly, stay organized and disciplined. If you are not going to stay organized and you are not going to keep your pace with the things as I post them, you will fall behind. And if you fall behind, 2 months down the road, if you try to catch up, you may not understand what I'm talking about, because basic points concerning those talks might have been discussed 6 weeks ago. So it's important that you stay organized and disciplined. And as I have explained in the Facebook group, my aim is to not post more than 60 minutes worth of stuff in a week, or maximum 2 hours in 2 weeks. And then every 2 weeks, as we have decided, I will offer a small summary in the form of a presentation, and we'll keep doing our case scenarios and keep going through an occasional article or so in the Facebook group. Thirdly, make notes and save articles. When you read a post, if I've spent 15 minutes writing a lengthy post and you read it, you may think, yeah, you remember and you got everything out of it, but believe me, 2 days later, you won't remember much of it from that post. So if it's If it's a 2-page worth of post that aims at highlighting 5 points, you just make a pen, pencil, or even if you use or some type of a Word document, you open it up and write down those 5 lines, 5 notes, 5 points as one or in a single sentence, or just a brief summary of them, so that you can read them when if you need to look back and revise those points. Fourthly, please participate to learn. As I said, this is an educational group. So your participation in my discussion and post, and if I pose a question, your answers, they will help me understand what you are thinking. They'll help me understand with my next topic or next presentation. So it's important that you participate, that I can use both as a reassurance that what I'm doing is giving results, and also as a feedback for myself, so that I can tailor my academic activities accordingly. And finally, as we all know, that in Facebook there are we have to be courteous and stay mindful of what of other members in the group or other friends, and so be kind. One other important thing is that whenever I post something, and if there are discussions is happening, please read those comments as well, because if you ask me the same question that has been discussed 4 comments ago, I really won't have time to keep repeating that stuff again. So read the post in a focused manner, then see if there are a few comments below it, go through those comments as well. And if you still have a question, or if you want your own express your opinion, please do so. Now, coming to what we have been talking about in the Facebook group for the last few weeks, the difference between information and knowledge. And as we have discussed over there, and I've had at least 3 case scenarios and with examples, and we discussed them, information is basically anything that goes into our brain from any source. So you're watching this video, you're hearing me, this is information. You watch a movie, that's information. You watch a TikTok clip, that's information. You watch news channel, that's information. You read a piece of information, that's information. You read something funny, that's information. You read a book, that's information. Someone comes and describes to you how their day was, that's information. So all that is information, and it can involve any type of senses. Now we live in an information technology era, and now this era is producing a lot of information, and information is essentially becoming a tool of exploitation. Many people confuse information with knowledge. They are very distinct. Knowledge, in contrast to information, is something very technical. Philosophers has been debating its definition for over 2 millennia. I have put forward a very simplified definition of knowledge here, and that's more consistent with the definition of scientific knowledge, but that is to help you understand that knowledge is not information, and knowledge is what makes an academician a good academician. Simply having information doesn't make one a good academician, because academics involves making progress in truth, in research, in discovery, in innovation, in new developments, in new technology. And you can only do that when you understand the true scientific principles and the true scientific data. And that is what knowledge is. Knowledge, by definition, is the truth that has been justified through objective evidence or infallible argumentation. So we'll continue to discuss it for at least next few weeks in the Facebook group, and you'll get a better understanding of it when we specifically discuss epistemology. Now, there are three major paths to knowledge. Scientific knowledge, and we all know what science is. It uses certain tools, it uses statistical methods, it uses scientific methodology to establish a truth or to establish evidence for a given hypothesis or a theory to turn, and that makes it turn into an established evidence truth. And the beauty about all this is that because nobody knows ultimate truth, so we evolve in this process. We evolve to learn knowledge, and as we develop more tools to study things, our knowledge also improves. The other important branch is philosophy, and it has been there for forever, and it's probably as old as religion. And that philosophy relies on argumentation, on logic, and it's not the way we argue, or common people argue. It's a specific field of how logic and argumentation works, and then they try to sort things out through argumentation and logic. And finally, the third important branch of knowledge is religion. And religion uses divine guidance or divine resources to establish truth. And all these three forms of knowledge, they interact. And as this group evolves and we slowly get into the clinical side of things, and because human beings, they have a scientific side, a philosophic side, and a religious side to them, we will see how they interact. We will see how they are pertinent, all three of them, when we deal with our patients, when we decide about clinical guidelines, when we decide about ethics of our profession. But we'll get to that point probably several months down the road. Now, just to highlight, and this is more of an academic point, that most sciences evolved out of philosophy, and physical sciences are way ahead of medical sciences in that sense, and psychology still has strong connections with philosophy. So it's important that if you want to be an academician and you want to deal with mental health, for which we don't have as robust scientific tools that we have for other conditions or diseases like heart disease or diabetes. So we still have theories, we still have a logical side to it, we still have a philosophical side to psychology. So it's important that an academician who is dealing with mental health or psychology or psychiatry, they have some understanding of the science of philosophy or philosophy itself. So this concludes this current talk, and see you back in the Facebook group. Thank you very much. Bye.